This is the Charlotte Maxwell revival of the lymphedema training. We are so excited. So here's a picture of Betty. She's the reason that we have a lymphedema program among many other things at the clinic. But she dedicated a lot of time and energy to learning how to be a lymphedema specialist and also to teach us more about lymphedema. And I just want to say that today we are blessed to have in our presence Betty Siegel's teacher, Marilyn Miller. Would you please come forward so we can appreciate you?
So I just want to introduce this woman, because really, we wouldn't have a lymphedema program without Marilyn Miller. Marilyn Miller, who is 96 years old.
96 years young.
96 years young.
Okay.
Who used to be a nun, then came out as a lesbian, and then became a major lymphedema practitioner in a time when really no one was thinking about lymphedema. You either had arms that were this big or you didn't have it. And so Marilyn actually trained Betty and enabled us to have a lymphedema program. Marilyn spent hours creating a lymphedema manual with Betty, creating the program. Marilyn had a hookup with this guy, Don. Don was this very eccentric, in some ways difficult man that Marilyn connected to, and he made innumerable garments that Marilyn and Betty would then find a seamstress to adjust them. So this was a really amazing program. Yeah, and it was at a time when now the hospitals are more tuned in to low levels of lymphedema, but not when Marilyn started. So this was a little card from Charlotte Maxwell. And a plant to thank you for coming, for showing up, for teaching, for being. She was a volunteer in the lymphedema program for way over 20 years. Yeah.
First, we're setting the stage. So we another component of this training is ethics, and we're going to be considering ethical treatment in terms of lymphedema and in general. And so I wanted to ground and kind of acknowledge the giants, more of the giants who we're standing on the shoulders of in speaking about an ancestor in my tradition of Chinese medicine. So Sun Sima was one of my favorite doctors of Chinese medicine and was considered one of the first people to write about medical ethics. And so I will read this quote, and I encourage you to all consider it. Whenever eminent physicians treat an illness, they must quiet the spirit and settle the will. They must be free of wants and desires, and they must first develop a heart full of great compassion and empathy. They must pledge to devote themselves completely to relieving the suffering of all sentient beings. And I believe anyone who works at Charlotte Maxwell does practice with this spirit. But I wanted to evoke that and consider that ethical care is a way that we put our values into action. And oh, by the way, I will share these slides with you later too, so you can have that quote. And I want to say my tradition is Chinese medicine, and it's an indigenous legacy of the Han people that has traveled throughout the world over thousands of years and been developing in a literary and clinical tradition. So Sun Sima is one of the people who formed that. Then in terms of CMC itself, we found this document. We don't know the date on it, but we were really moved by it. It's Principles of CMC Volunteers. And you can sort of see our values and ethics in action. I won't read the whole thing, but you can look at this. But the idea that we operate on a basis that we do not believe women cause their own cancer. Right? We do everything we can to prevent a woman from blaming herself for her cancer. Our function is to support women in their own treatment choices. So you can see our ethics and values expressed in these principles. I'll pause so you can take that in for a moment. And I'm going to highlight the last bullet point here. How we recognize our own feelings about cancer, illness, and dying will arise in our work with women with cancer. And we're committed to resolving them cooperatively outside of the treatment setting. And when we found this document recently, it made us look again at the check-in at the end of the shift and kind of go back to something that was done previously where we invite volunteers to share a little more of their own feelings and how they're kind of doing with this work, because it can be very heavy work. So you'll be seeing that the check-in time on our shifts emerging a little bit with a little more invitation to recognizing our own feelings and providing a forum for us to engage those. We have, you're familiar with body systems. And first we're just going to look at, well, what is the lymphatic system, right? So we all know the cardiovascular system and the way it's organized. We have larger vessels that are vertical. We have connecting vessels that are horizontal. If you're an acupuncturist or trained in the meridian system, you'll recognize that is also how the meridians are organized. The lymphatic system is much like that, right? We have larger vessels that tend to run vertically and connecting vessels that are horizontal. We have some other aspects. We have lymph nodes that are the most famous part. But the systems mirror each other. They echo each other, except there's a very big difference, is that the lymphatic system doesn't have a pump like the heart and lungs. So that's why when we talk about lymphatic care, we need to embrace other ways to support lymphatic circulation. So just an overview, and I know most of you know this already. We're just trying to get everyone kind of on the same page with their information. Also, a lot of this same material is going to be shared in our client workshops, just so you know. Lymphatic system has 3 parts. There's the lymph itself. It's the tissue fluid that has water, protein, cells, waste products, and importantly, immune cells. So lymphatic system and immune system are really the same system. We don't always name it that way, but in this lymphatic fluid are traveling our immune cells. We have the lymph vessels that are the pathways by which the lymphatic fluid travels. They collect the fluid from the tissues and return it back to the venous system. So one way to think about the lymphatic system is as our waterways. So in Ayurvedic medicine and Chinese medicine, we think about how water moves through the body. The lymphatic system is analogous to those water pathways. And finally, the most famous part of the lymph system, I think, is the lymph nodes, right? So we've probably all noticed swollen lymph nodes or been trained to assess lymph nodes. These are where the immune cells get together. It's where the lymphatic fluid is filtered, and each lymph node is like a hub of the lymphatic system. And here's another nice diagram that shows important places of the lymphatic system. So you can see again the general organization, but you also see highlighted in green, these are important kind of pathways where lymphatic action is very, very potent, right? Where there's lymphatic drains that help return this water back into circulation. So we have across the chest, we have the inguinal lymph nodes, we have the axillary lymph nodes. So when thinking about your modalities of bodywork or acupuncture, right, these are important areas that we work with. In manual lymphatic drainage, these are important areas. I really love this, and thank you, Lucy, for sharing these images. We also have this on the back, right? So a lot of times we may think of the lymphatics and feel for lymphatics on the front body, but we can really access the lymphatic system across the back. So noticing these areas that you're probably working with when you work with the body already, but noticing, when I'm working adjacent or with these areas, I'm also influencing the lymphatic system. So again, throughout the day, my portion is kind of the academic and theoretical portion, and then the afternoon you'll be meeting with your in modality breakouts and really getting to the clinical application. So, but when you come to that, think back to this slide about important areas where we can influence the lymphatic system or where the lymphatic fluid gathers and goes back into circulation. I really love the Ayurvedic way of thinking about the lymphatics and the This whole system is referred to as the rasa, the river of life. So this is an actual river, braided rivers, but this is another way to think about the body's water moving. And there's a lot of techniques in Ayurvedic medicine that work with the lymphatics. So the laughter yoga is kind of a modern version of a way of working with lymphatic system that's emerged in the last 30 years, but that stimulates the flow of the river through activating the diaphragm. So the causes, there's two types of lymphedema. There can be a congenital lymphedema or primary lymphedema. There's secondary lymphedema that's due to an injury or an infection. People with cancer are highly susceptible to lymphedema, both from the cancer itself, the radiation, and the surgery. And imagine if you have a blockage in this system, what can happen? I was interested to see this. According to the World Health Organization, about 1 in 30 people worldwide has lymphedema. That's so much. Part of it is because it can be secondary to infections and parasites. So globally, there's a lot of lymphedema that's not necessarily cancer related, but related to parasites. But it's a widespread problem. Some of you helped us do a survey at CMC. We found of our current clients, about 25% were reporting symptoms of or a diagnosis of lymphedema and or neuropathy, and quite often both, right? And then in terms of breast cancer, there's a range of data, but approximately 20 to 30% of breast cancer survivors go on to develop lymphedema at this point. So that's so many people that are dealing with this problem. Also with gynecological cancer, even higher rate. 37% in a recent study developed it also within 18 months. So when you're dealing with our clients who have gynecological cancer, sort of that's an area to be sort of extra on the alert. Higher risk of lymphedema there. It's also a disease that seems to affect women of color more greatly. So Sloan Kettering Cancer Center showed that Black and Latino women were 1.5 to 2 times more likely to acquire lymphedema after lymph node removal. So, and I'm sure you can think of potential reasons for that, but that's another area to be aware of which clients who might be at risk. Guess how much training medical students get about it? About as much as they get in nutrition. About 30 to 60 minutes, apparently, typically in the entire lymphatic system, not just lymphedema. So doctors are not trained in this. Obviously, if they're oncologists, they're going to have some more training, but in terms of just your average GP, they're not really taught about the lymphatic system at all. And you've probably found this, but many CMC clients have had radiation, have had surgery, have had lymph nodes removed, and have never been told about lymphedema or the risk of lymphedema or precautions. Yeah, I'm seeing nods. Many of us have seen this in clinic. They're not getting that basic piece of education. So this is where we need to step up and really begin to offer that and help. And we're going to talk about ways we can help identify clients who may be at risk. They're all at risk, essentially, but even more at risk, talk to them about the dangers and the precautions. So what are the precautions? And I know this first part's very dense, and I will pause for questions in a little bit. Here's another slide that just is showing you the incidence of lymphedema, and you can see again that Black and Hispanic women in this study were much more likely to get it. So it's something we really need to be aware of with our clients and think about, what are the reasons for those disparities? What can we begin to do about those and offer that extra support? So what causes it? And again, it's partially just not known. We can point to certain things, and in certain individuals, we can point to something that happened that down the line, then they develop lymphedema. So it's thought that injuries, potentially long-distance flights, potentially overuse of a body part, wearing too tight of garments for a long period of time. High temperature exposure potentially can be a trigger. Things like sunburn, things like overusing saunas, even extreme heat. And I think about this in terms of a health disparity and also with our climate crisis. Extreme heat is the most dangerous of all the effects of climate in California in terms of effects on people's health. So what does it mean for our clients to live through extreme heat days, maybe who are at risk of lymphedema? Infections, mosquito and insect bites, again, another area that's increasing with the climate crisis, putting people at more risk. A higher BMI is also associated with a greater rate of lymphedema. This is an important slide to look at, and this is where you can help us as practitioners. It's staged from stage 0 to 3, and you can see in stage 0, and this is where we want to ideally catch it, is that we can't see any change. There's no evident visual swelling in stage 1. In stage 2, we're beginning to see already some significant swelling, and we might have a limb that feels spongy. There might be, stage 1. Stage 1, thank you. The arm is swollen and feels heavy. So begin to have a little bit of swelling in stage 1, but what the client may report is a feeling of heaviness. So a question acupuncturists often ask, right? What's the sensation of heaviness? But it could be something subtle. We might have the beginnings of pitting edema at that point. So if pressing on the swollen area would leave an indentation. In stage 2, we have more significant swelling, you can see from the slide. And we now have non-pitting edema, so pressing on the area doesn't leave a dent because there's so much fluid that's built up and staying in that area. And then stage 3, this is where we really want to avoid getting to. Advanced stage, we may have extreme enlargement of a limb or an area. So because we have so many breast cancer patients at our clinic, a lot of our material pertains to breast cancer, but any type of cancer in any area, the person can get lymphedema. So there's also facial lymphedema in the lower limbs. It can really be in any body area. But this stage 4, you can get an example of the dysfunctional lymphatic system, how significant it is and how much it affects people's health. This shows you at the earlier stages a subtle difference. So you can begin to see between these two limbs, the lymphedema arm, you can't see the skin folds, you can't see the tendons. So when you're working with clients, this is something you could be aware of. And if you note, for example, which side they had a lymph node removed on, you can keep an eye on that limb as you're working with them and notice, oh, is the skin looking a little more shiny? Is it looking a little more puffy? Or am I losing that definition? Can I not see the tendons on that side, or can I not see the wrinkles? So we can help identify the client at this stage might have that heaviness, or they might not really have much of a symptom. And again, you can apply this to other body parts. We begin to, at the earlier stages, have a bit of stiffness. So you can kind of subtly see on the left thumb, the person can only reach the mid-palm, whereas the non-affected arm, the limb retains some mobility. So another subtle sign, but a good thing to even talk to clients about, or maybe something you observe if you're a body worker, maybe if you're doing some mobility work with them, you notice, why is this side not as mobile? So, and these are also self-checks that you can teach clients. I have a couple red flags in here, so notice those. This one is, there's, and this was, I think, on the quiz maybe. This one is potentially deep vein thrombosis is a very dangerous thing that could look a little bit like lymphedema in an early stage. So I'm putting this up here to help you distinguish. Lymphedema can be anywhere, whereas deep vein thrombosis is affecting typically just one leg. But they both may have a feeling of heaviness and swelling. But with deep vein thrombosis, you have localized pain, which is not common in lymphedema unless it's very advanced. In lymphedema, we tend to have a general aching or discomfort. With lymphedema, we're really worried about repeated infections. With deep vein thrombosis, it's an emergent condition, so it's not recurring infections. But both of them, if there's a warmth of the area, or if there's a red or discolored skin, those are really red flags. So they have some similarities. So I wanted to put that in front of you as a potential red flag to be aware of. Now, with lymphedema, these are some complications that we worry about. It can, obviously, if it affects a lower limb, it could cause gait changes. Anywhere in the body, it can cause a decrease in functional range of motion and strength. Impaired sensation, and this is where lymphedema can overlap with neuropathy a little bit. You can imagine if that lymphatic fluid is built up, right? It's potentially impairing the person's sensation. If it gets really bad, it can progress from a limb into the central part of the body, could affect the posture. And there's a complication, or it can be a complication, it can be an independent problem called cording. I have a picture of that, but here's a couple examples. And I wanted to point out, one aspect of lymphedema care is caring for the skin. And so again, an area we may be able to help flag and support patients in noticing any skin changes, changes in pigmentation. So a redness or a duskiness or a purpleness that shows up on the skin. And then you can see the picture with cellulitis. It can be very, very extreme, right? With that extreme redness, shininess. In a more melanated person, the skin may not look red, but it may look more purplish or darker. So something we can be aware of. And here's the cording. What happens is that potentially the lymphatic vessels get fibrotic, and it creates a hard cord that runs along the lymphatic line. Turns out this is one of the few aspects that is very treatable with exercise and massage and can be reversed. But it's something we also want to prevent and be aware that it can happen. And it can feel like a palpable hard cord in the limb. So the signs and symptoms, you've got an idea. But I also want to point out, that full sensation of skin tightness, loss of flexibility. Here's another clue. My ring or my watch or my bracelet is not fitting as well, right? Of course, there can be other causes for that, but if a client reports that or you observe that, that could be a sign that there's a lymphatic issue in that limb. Also, changes with how clothing is fitting. So this is also what we can share with our clients. How do we prevent this movement? So there's no pump. What is the lymphatic system pump? I showed you those slides, but I didn't quite say it. So circulatory system, we have the heart and lungs, who I know some of you know. How do we move the lymphatic system? Muscles, body movement, what else? Manually, right? So self-massage, fluid movement. And one of the key ones, well, why would laughter yoga be good for lymphatic health? The diaphragm breathing, right? So one of the key points for prevention is increasing and maintaining an exercise program. So moving the skeletal muscles, a lymphatic pump. We can manually do it with self-massage and self-care. And then breathing, right? Breathing is key. So and other prevention tips are using compression garments when flying or for prolonged sitting, and avoiding temperature extremes, tuning into the body. And these precautions are really lifelong. That's why it's so worrisome when we meet patients at CMC who've had surgeries, who've had cancer, who've had lymph nodes removed, and who haven't been told about precautions. So what's the typical treatment? And again, this is the standard treatment. 3 aspects of management: reducing the edema, caring for the skin to protect against infection, and managing any complications that come up. What's always in the literature called the gold standard of treatment is complex decongestive therapy. So it's an intensive treatment that happens over some weeks with frequent treatment over that time that involves lymphatic drainage, compression with bandages, skin care, and exercise. And it's not necessarily an easy thing to access, right? So this is the gold standard, but it's not apparently even in the Bay Area, something that's easy to get into depending on people's healthcare coverage. But it can be very effective. So it involves lymphatic drainage, compression with compression bandages, and exercise with bandages on. So it's sort of a dramatic treatment to reduce the swelling. And you can see from that picture one example of how much it could do if a person is able to access that kind of care. Then the idea is maintaining so that we don't get back to that lymphedema state. One thing that we can really coach our clients on is skin care. So anyone who's at risk of lymphedema, and this is typically in the limb that's adjacent to where a lymph node is removed, would be the most obvious area for this. Keeping the skin healthy, using a gentle and pH balanced soap, and using a pH balanced lotion or cream or a moisturizer. We recently in the herb pharmacy started carrying a calendula ointment, and I was thinking that would be a wonderful lymphedema support and prevention thing to massage on. So something to be aware of in coaching the clients. But I think I'd like to bring in more of a line of skincare into our clinic. Of course, that wise man balm could also be really good in preventing infection. So that's something that I give a ton. Self-care. So we can speak to our clients and encourage their self-care using compression garments, using night garments if they have those, doing self-massage, and we'll be in our modality breakouts, we'll be speaking a lot more about that. Caring for the skin, and then protecting the affected limb. So you could see from the previous slides, right? It's important that they protect the affected or vulnerable limb from insect bites, from sunburn, right? And then how many of our clients are doing a lot of housekeeping or other type of work, wearing gloves for that, right? Being aware of protecting against chemical burns if they are doing, for example, house cleaning with chemicals, avoiding exposure of the or minimizing exposure of the affected limb to that. This is a good time to pass it out. We've got a handout that we'll be giving out to clients and we'll have available in the clinic. And this is our Lymphedema What You Need to Know handout. It's a short version of the lymphedema manual that was mentioned earlier. And it's a one-pager for clients. And so it talks about some of these precautions. So we'll have these available at the clinic, but also something wonderful for you to share with your clients. And here's some pictures, if you've never seen them, examples of what these compression garments might look like. And there's typically, if the person has access to it, a padded one that you might wear at night so it's more comfortable. Avoiding injury. So again, this is all in that one pager. But even thinking about getting manicures or pedicures. I was going to drop that one out because I'm not that kind of girl, but Gabriella told me, no, our clients get manicures and pedicures. They need to be talking to their provider about their condition and really advising extra care and avoiding any cuts or any scrapes, any injuries that might occur during manicure or pedicure. Oh, please, yeah, you can, if you got an evaluation form, just hang on to it. We can use that later. Here's another area that we can really help is avoiding infection. So there is the typical signs that you might see of any infection, right? Flu-like symptoms, fever, heat, skin rash. If a client who is at risk of or who has lymphedema has these signs of infections, it's potentially very, very dangerous. So we want to be alerting their doctors and caregivers right away. Yes, and feel free to stretch. We'll have our self-massage very soon, but feel free to move and stretch at any time. In terms of exercise guidelines, we have a volunteer in our purview who was told after her cancer surgery 30 years ago to never lift anything over 5 pounds with the affected arm. That advice has really changed, right? So now we know that exercise is important. It's therapeutic. You don't want to avoid exercising that limb. You do want to be cautious. So this is sort of a typical cancer exercise guidelines that are offered now, that strength training has in fact been shown to be very beneficial for lymphedema. And we don't want to avoid using that arm, but we want to be protective and we don't want to injure and overuse that arm or that limb. Right, so this is an important piece of advice that you can be sharing with clients. They don't have to avoid lifting. Of course, if their doctor's telling them to avoid lifting, you're going to need to. Well, it's a good question, right? But potentially share information that advice has really changed. We don't want to avoid using that affected side. We want to use it to keep the lymphatics moving, but we do want to be protective against injury. So. We've made a change because we hope that bringing this education program back, we're going to all be more aware of lymphedema. And one thing that we noticed is that in our charting, so the medical alert at the top of the chart, we have the cancer information, but it's not always easy to find. And in fact, some of you have shared this with me. I can't always find if the person has had lymph nodes removed. I might have to dig down very far down into the chart to get the right answer, right? So what we've done is we made a change in the medical alert at the top of the chart. So you know when you open the chart, there's that box at the top. We've now added, so this is an example, right? In the past, it would just be, which is great information, their priority, the type of cancer, the diagnosis. We've added a line, and they're being eased into all the charts slowly. It has to be done manually, so thank you, Piper, she's doing it. But as you begin working, you begin seeing this line, and we're going to ask you to fill this in when you see this, digging through the chart, finding what would be the best place to find this? The initial cancer summary page, you think? Yeah. So if you can take time to dig down to that initial cancer summary, if this isn't already filled in, you're going to put how many lymph nodes removed, where, and do they have lymphedema, yes or no? So when we add this, now we'll all be able to be aware and to take precautions and lift each other up in providing this advice and information for the client. So it'll take a little while to get this completely rolled out, but I really appreciate your support in making this change so that we can be aware. Can you think of what, if the person had lymphedema and we didn't know what potential harm could be caused by our treatments? Yeah. Here, look, I can come down. What could happen?
You can cause the symptoms to be worse. You can add fluids where it's not supposed to be. And if you don't modify massages, you have to make sure that you don't stroke into those areas. So I always ask my patients, even if I do have the information, I ask them again how many lymph nodes so they can be aware of it and educate them too, to remind other people who are moving fluids in their bodies. Hey, I have lymph nodes and these are the areas that are sensitive. Can you please modify your strokes?
So you're encouraging them even to tell their other providers, because you're asking them, but you're also telling the client, be sure that anyone who works on you knows this. Really smart.
A lot of clients don't realize they have the power to facilitate their healing by articulating what it is they have, not assuming that we should know what they got. We should be a partner in their healing, not telling them what they got, but sharing the information and making sure they have the right resources to articulate, because sometimes they may go to a spa for a massage, not knowing their massages needs to be modified. I don't know nothing about acupuncture, but for massages, their massages need to be modified accordingly.
Thank you so much. Yeah. And also our value. I love how you're lifting up our value about partnering with clients and client empowerment. Right. So really beautiful. And now that I'm down here, is a good time for questions or comments. You can raise your hand and I can come over to you. Yeah. I think this is going to go pretty far.
I just have a question about like a general compression sleeve. Is there like a recommendation for prevention of lymphedema that people recommend that we can recommend to clients?
Yeah, I mean, if they're at risk of it, like the experience I've had is that if they say they've had a lymph node removed, they would want to use a compression sleeve, maybe for flying or for certain times, not necessarily all the time. Is there anyone here who has another thought about that? If we're just worried about risk without just kind of a risk, say maybe they've had a couple lymph nodes removed, would you typically go with wear compression for flying? Is there any other time? Right. Okay. So yeah. So travel or going to a day-long CEU class or something where you right. Right. Okay. So if long periods of inactivity, if that's part of their life, they might want to wear compression during that, even in the absence of having really even stage 0 lymphedema, but just as a prevention. Right. Oh, about which particular sleeve? Okay. Right. Anyone want to help me out with this? I want to say that we used to have a great program where we fit people for garments, right? And we want to bring that back, but we don't have Betty Siegel, and we're trying to come back to that. So that's one part of it. But yes, another thought on that. Specific recommendations, I'm not totally aware. Yeah. We were talking about that earlier. Yeah. Okay. So the discussion was that there are stores in the area and in the Bay. So we're also repeating because we're recording this. Stores in the Bay Area that offer garments and offer fitting. That potentially it should even, there was a law that it should be covered by Medi-Cal if you have been diagnosed with lymphedema. And we know that it's not always easy to get that to happen, but we know that the law is in place. But the question was, what do we do as a prevention thing, aside from retail stores? I'm looking for help from our audience on what options you're aware of out there.
I'm just wondering now, all the oncology centers have lymphedema programs. And I'm sure there's a lymphedema practitioner at the place who can give us those guidelines. Because I don't think, because one of our principles is we don't recommend anything we can't give our clients. So we don't have the recommendation of what to buy because we are clients. But look, we got somebody from WCRC going to speak up. Come on, girlfriend. I just want to introduce this other woman here because Dolores is Ms. WCRC. All of you hopefully know about WCRC. And Dolores, like me, still here. Dolores has been running a Black women's support group, which is called Sister to Sister. Anyway, so she knows a lot about cancer in the world, and she's threatening to leave, but...
Oh, thanks for telling that.
But she won't, hopefully.
So there's the National Lymphedema Society. You could actually go online. There's another group of young women, and the name's escaping me. No, not Bays. It was called Diva or something. So they also are young women who talk to other young women, and they have sleeves that are made to work, but are also very beautiful, so that younger women will not feel ostracized or embarrassed. And I'll try to think of the name, but I can't right this minute. But you can go on the National Lymphedema Society, and they have a bunch of different guidelines. Thank you.
Thank you so much. All right, we have time for one or two more questions on this portion. We're gonna do our self-massage and take a short break, and we'll be talking about lymphedema care and integrative medicine in the next section. But yes.
I just want to have one question to confirm. From my understanding, I could be wrong, you don't have to be a cancer patient to get lymphedema.
Absolutely, right. So there are many potential other causes. So it can be congenital as one, so a congenital variation in the lymphatic system. It also can be secondary to infection. So yes, in terms of our clients, it's likely that it's the cancer or the treatment or the surgery, but it can affect people beyond. Yeah.
And my sister has it, and I was trying to help her, but I was told because I wasn't licensed not to touch her. So I refer her to either people who are licensed or CDT who can give her the proper resources and training. But no, not everyone who has cancer, not everyone has cancer and gets lymphedema. That's important for people to know.
Yeah. And, there's a lot. Yeah. Well, we have more to say later. Okay. Yes.
Thank you for the great talk. I have one question that I often have patients ask me. The dry sauna is not too good because of the heat. What about the steam room? Was steam room considered okay? Thank you.
Yeah, this is a tricky question, and I think it's a matter of the degree of exposure, right? So potentially some heat exposure I think could be fine, right? And so whichever type, but we don't want extreme heat protracted for a period of time. Is that pretty much it, Gabriella? I mean, we don't want people, you're never going to go in a hot tub again for the rest of your life, but we want to avoid extreme and prolonged heat exposure. So potentially steam might be fine, but I would still be cautious. They can also, knowing some of these signs of the early signs, if they notice, I did that and I felt a little achiness in that side, right? To notice, maybe that wasn't so good. But the big thing we want to avoid is things that compromise the skin. So with those heat exposures, a sunburn or a skin burn, right? That's going to be the most dangerous. All right, so we'll talk a lot more about lymphedema treatment. I want to change the vibe a little bit, and you're gonna say, why did they ask us to bring a towel to this training? This is why. So in the course of doing this research, I found out about a Japanese technique called Kanpu Masatsu that is apparently taught in schools and throughout Japan as a self-care technique for immunity. So it supports lymphatic and immune health. In the past, we used to teach dry skin brushing, and I'm actually offering this as an alternative to dry skin brushing. I think it's safer because it's not as abrasive to the skin. Also, you don't need a brush. For our clients, they're going to have a towel. In fact, we're going to give towels in the client training, but they're going to have a towel, and the towel encourages you to use a light pressure. So it's actually, I think, a safer option than the dry skin brushing. So I'm going to ask everyone, if you have the towel, go ahead and get that out. In terms of the self-massage, I'm thinking of that as more of a general lymphatic tune-up and prevention. You could see that the way we went through the body, it wasn't the methodical lymphatic drainage, step-by-step method of working with the body that you might learn in other modalities. This I see as a general kind of lymphatic and immune tune-up. So it's taught in Japan, apparently, in school settings as an immune support. And we know how these interact. So I'm also thinking of this as, I'm sure we do lots of self-care, but it could be another easy self-care modality to add to your own toolkit. And again, something simple to share with clients. We had some good discussions about how that light touch offers a regulation to the nervous system. And I really felt that. I was like taking deep breaths, and I think it has there's a subtle power in that kind of touch. And I know personally, if I do self-massage, I tend to like dig into a tight spot. And this offers such a different way of approaching the body. So this next little section has a few components, but we want to begin to think about how we do integrative lymphedema care. And I did some diving into the literature to see what literature there was on this. Of course, there's not as much as I wanted, so I'm going to share some of that with you. But the first piece is another video that I really love that, again, it's recapping the lymphatic system, but it's made by a massage therapist. And so what she does is she draws the lymphatic system on a model, and she speaks about the lymphatic pumps, and it begins to tie into, again, our work in integrative medicine and how we regulate the lymphs. She's talking terribly fast, just to know. I encourage taking some deep breaths while you listen to it so you don't get too stimulated by it, but I love the kind of overview of the lymphs, and it helps build a basis for our work in integrative medicine. When we're doing manual work, right, opening up the center so that the lymph has somewhere to go, it seems to be a tip that is shared in all the research that I've seen on manual lymphatic drainage, and the different, sometimes very contentious schools of lymphatic therapy seem to agree on that, if not always other things. So something to keep in mind, and thinking about your own modality, does that apply to your modality? This is such a fun event because we're bringing so many years of experience and different perspectives and modalities to this work, but I'm sure you're thinking a lot about how does this apply to what I do? How am I already working with this, and how might my work be enhanced by this? I'm going to just keep moving. So on that note, I know a good number of you are energy workers of various ilks, and you may have other terms, but we kind of put you under that category together. And I'm curious, and I know we'll be having a discussion for those modalities together, but how you think about the lymphatic system and the energy system. So I love Alex Gray's work. And this is such a cool slide because it's got the circulatory system, the lymphatic system, the meridian system, the chakra system, and the subtle energy systems, and thinking about how these interact. So some of us were discussing that self-massage, right? And how that affected us maybe energetically. And so I think of, in Chinese medical terms, that the lymphatic system connects also to the Wei Qi field, right? And the Wei Qi field, yes, it exists in the Zhou Li, the space between the skin and muscles where the lymphatic fluid flows, but also outside the body, up to a variable distance outside the body. And so our subtle work also, I think, really interacts with the lymphatic system. And of course, the Sanjiao, if you know Chinese medicine, is connected to the waterways. But this is up here sort of as a thought of how the physical systems of the body interact with the energy systems. And one analogy that comes up when we think about the lymphatic and immune systems is around boundaries, right? What does the immune system do? It establishes boundaries between self and other. So I think that sometimes these treatments that work on lymphatics also connect to, again, immunity, and may help us work with energetic boundaries. Certainly and we can talk more in our Chinese medicine section about how this connects with the Sanjiao and other organ systems. All right, so this is what I found. I went into the literature and tried to find evidence and meta-analyses of integrative treatment for lymphedema, because I wanted to find out, well, what's been happening in the last 30 years or so, what research has been done. And of course, from a Western point of view, the teaching is and the thinking is once a person develops lymphedema, there's no cure for it, it's always management, right? And that pretty much is borne out when I look at the integrative literature as well, but I wanted to see, well, what's being shown or what's being seen about lymphedema treatment. And what was so interesting about this research dive is there's so much work coming internationally, and especially a lot of work coming from China, where they're using acupuncture and Chinese medicine modalities for lymphedema. It's not only happening in China, but that's where a lot of this work came from. And even if you don't do these modalities, I think there's something to be learned from it. So the first one was a meta-analysis that looked at acupuncture, moxa, and combining the two in warm needle acupuncture. They found that lymphedema management was as effective or even greater than using compression garments. And again, I think they could easily be combined, but they really found that acupuncture was quite effective. And typically in Asia, they are doing acupuncture on the affected side, not only avoiding that side. So that's something to note about a lot of that was a meta-analysis of international studies, but a lot of them were in China. For massage therapists, to note that Tuina, so Chinese medicine-based massage, compared favorably with complete decongestive therapy for lymphedema reduction. So they were seeing in manual therapy similar results to that sort of complex of using the compression garments, the exercise, and the Western decompression therapy. So that was really interesting to me, that it, even though in the West, CDT is the gold standard, we might be able to get similar results with acupuncture and Chinese medical massage. Manual lymphatic drainage has also compared favorably with kinesiotaping. So I thought that was exciting because kinesiotaping is potentially something clients can learn to do themselves or get help doing at home. Potentially, that's a modality we could offer, I could imagine, right? And it's inexpensive and accessible. There are online videos that show it. I do think the ideal would be to work with clients to individualize that, right? So not necessarily just say, here's a YouTube video, follow this, but working with them. So that's something we're exploring, how we could build that out as a modality, along with also manual lymphatic drainage, which a couple of the breakouts are going to be focusing a lot on this afternoon. Another exciting one was about yoga. So they this was a meta-analysis actually it was a meta-analysis, but it was a relatively large study that had a yoga program for people with lymphedema, and they found improvements in quality of life, in strength, range of motion, and tissue health, but not necessarily limb volume. Nonetheless, a lot of other things got better. So it's showing like, yes, this therapeutic exercise and yoga can be more than just therapeutic exercise, but had some great results. And then I really like this last one. So meta-analysis of acupressure studies showed improvements in lymphedema management, function, quality of life, and inflammation. And for those of you who want specific points, the most commonly used points in that study, again, it was acupressure, P6, Li4, GB21, La11, lung 5. So again, not necessarily local points to the lymphedema area, but more systemic points that are working with inflammation, water regulation, qi and blood movement in the body. And then this last study that, again, I have another short video that I think is really moving, was about quality of life with acupuncture. It was one of the first ones to be done in, I think it was 2016, and it was in England. And I'm gonna show a short video because it also shares a lot about the patient experience with lymphedema. So that's another piece that we really haven't touched on, is what is it like to live with lymphedema? And I'm sure many of us are already talking with our clients about that. But this short section focuses on one person and how much she was helped by acupuncture for her lymphedema as part of this study. So a bunch of you have tried laughter yoga before, I heard. That's so exciting. So this is a modality that is particularly dear to me. When I began my journey in integrative medicine studies, I went to India and lived in an ashram for 4 months, and we would do, there was a meditation that they highly recommended everyone do, and it lasted for 3 weeks. In the first week, you would laugh for 3 hours a day. In the second week, you would cry for 3 hours a day. And the third week, you were so happy. All you had to do was meditate for 3 hours a day. And I did this when I was in my mid-20s, and it was part of a massive transformation that resulted in me becoming Nishanga. But I always loved laughter and saw the therapeutic value. Well, it turns out, I did this in the 90s. It turns out there was a doctor Mudan Kataria, who started teaching and developing laughter as a therapy, calling it laughter yoga, and he's been developing this since that same time, and it's become international. So I recently trained as a laughter yoga leader, and I'm starting to offer this in different settings, and it's just so much fun. So you'll be happy to know we don't have to laugh for 3 hours. Although I highly recommend that as a therapeutic thing. You do it in a group, so it gets easier. I'm going to tell you a little bit about laughter yoga and the benefits and what it can do, and then we will turn off the recording. So we will put down the mic, and we'll gather in the back, and I invite you to share it together. So I just want to tell you a little bit more about it and what it might do, and it's also its connection to cancer care. So what is it? We engage laughter as an exercise. So you're learning to laugh without any humor, jokes, or comedy. You're learning to laugh for kind of no reason. And you're doing this sort of first way to think of it is as a physical exercise. It's like a mini workout. How we do it is we engage laughter in a group setting, and through eye contact and childlike playfulness and breathing exercises, we start kind of faking it till we make it. And then usually when you kind of make yourself laugh, it gets funny and you spontaneously laugh. So I'll be teaching you how to do that. It's called laughter yoga because it intersperses yogic breathing techniques, pranayama techniques, with laughter, playful laughter exercises. Does it count if it's not real? It does. So that's a really neat thing, that your brain and body don't know that you're just making yourself laugh. You get the same benefits whether the laughter is spontaneous or you're, really laughing, or you're just kind of making yourself laugh. So there's a doctor in India, Dr. Madan Kataria, who started it in the 90s with 5 people in a park in Mumbai, and it's now become an international phenomenon. It's practiced in over 120 countries. There's thousands of laughter leaders around the world. So this is him, the laughter guru. But actually this video is talking about laughter yoga and cancer care. So I'm just going to show you this just to get a glimpse. You also see some laughter yoga in action, but it gives you a little glimpse of some of the benefits and application of this technique. Why do laughter yoga instead of just laughing, right? Or going to funny movies or getting together with friends and laughing? Part of it is the duration. When we laugh spontaneously in life, it's usually only for a few seconds, right? And so to really get the health and emotional benefits, you need to laugh for longer, like 10 to 15 minutes or a little more. Really makes a big difference. So engaging laughter as an exercise will help us with that. Also, we need to laugh heartily, right? And ideally loudly. So we might not always socially want to do that in every setting. I know sometimes I'm self-conscious about my loud laugh in certain settings. So now we're creating a setting where it's okay. And the hearty laughter that engages the diaphragm is part of what, again, stimulates the lymphatic system. It's amazing the health benefits. It lowers blood sugar. It lowers blood pressure, right? These things happen when we laugh heartily and engage the diaphragm and the core. Also, and I think this is really true in our times, right? We can't always count on life to make us laugh. There's plenty of reasons not to laugh in the world we're living through. So we learn to laugh, and we learn to laugh for no reason. And it's amazing how beneficial it is. Some of the benefits are your mood is immediately elevated and changed. Again, circulation, blood pressure, blood sugar. I thought that was really interesting. It wouldn't be something I would immediately think of, but laughter yoga sessions can result in better blood sugars over time. They're obviously immune boosting. Your brain benefits. So we're bringing oxygen to the brain, right? We're regulating the nervous system. The social connection with laughter yoga, especially when we make eye contact. And, we'll be talking about the polyvagal theory later, but just if you already know about that, just think of how much connecting with others in a safe, supportive setting can do to regulate the nervous system, help us take us out of fight or flight to a connected state. And then we can also learn to laugh through challenges, right? It's like we're exercising our laughter muscles. And then just specifically for our group as caregivers, there's a lot of research about it. So if you go online, you can type in laughter yoga, you can find groups worldwide and videos and techniques, and you can find a lot of research. This one I thought was touching because of the people in this room. I know the font is really small, but it was a randomized trial that was looking at laughter yoga interventions for stress and burnout in nurses during the COVID pandemic. And what they did is they separated into 2 groups. They gave one group laughter yoga sessions and the other, I don't think they really had a placebo. They just didn't give them the session. But they got it later though. They found that those who did the laughter yoga had statistically significant improvements in burnout and in life satisfaction. So and there's many studies like this if you dig around for it. It's thought that it's an effective way to treat stress and burnout and increase life satisfaction for caregivers. So something that everyone in this room might benefit from, bringing a little more laughter into your life. So I'm going to share the sort of standard laughter yoga method with you, but I also encourage you to think about ways to just sneak a little more laughter in. I know I've been trying to laugh while driving and also laugh while taking a shower and just building that. Also laughing first thing in the morning quietly. And as you'll find out, silent laughter is actually even better workout. You get a real core workout if you laugh silently. So that you can do almost anywhere.